Hi, this is Billy. Billy is in their third year of university. They've had the same friends since first year and live in the same small student house. But recently, Billy has started feeling stressed and worried constantly. Why could this be? Billy's always been nervous in social settings, avoiding them at all costs, and keeping their social group small, and obviously doesn't like public speaking. But they've always been like that. So, what's new? Billy has been finding themselves thinking about graduation and their future a lot. Maybe they're in the wrong major, maybe at the wrong school. So much that it's consumed their life. They've started staying home more, eating less, and losing a lot of sleep. Billy's friends are starting to notice. Billy may have general anxiety disorder. Okay, so what is general anxiety disorder? A study done in 2018 by the National College Health Assessment reported that 63% of college students have experienced severe anxiety, and 23% have been diagnosed or treated by a medical professional. General anxiety disorder is the most common disorder in university and college students. Billy is just one of many. General anxiety commonly arises at difficult parts in life, like going away to college, for example. It can become a long-term problem when not addressed. Symptoms of GAD can be seen in many different forms, but are generally always being worried or anxious, overthinking, viewing events/situations as threatening without any reason, inability to relax, indecisiveness, and more. These symptoms can lead to physical symptoms like constant tiredness, muscle fatigue, tension, nausea, sweating, and trouble sleeping. What is causing this anxiety? There are many reasons, like genetics, brain chemistry, development, and life situations. Everyone is different and experiences everything differently. Should Billy get help? Yes, their day-to-day life is beginning to become affected. Without proper help, Billy's patterns can become worse. After talking to the school therapist, Billy talked about what is going on and got prescribed a benzodiazepine. Benzodiazepine is a category of anti-anxiety medications that enhance the neurotransmitter GABA, gamma-aminobutyric acid. GABA functions to send calming messages to the brain. This counters the overstimulation seen in anxiety. Treatment comes in many forms. Symptoms of GAD are usually helped with medication, therapy, coping mechanisms, and relaxation techniques. After treatment, Billy is now able to talk confidently about school to the therapist, who is helping them plan and explore different paths in life.
Hello everyone, this is Steven. He is a passionate student who takes his education seriously. During the COVID-19 pandemic, all of his classes were online, so Steven barely left the house. Even the thought of stepping out during the entire pandemic frightened him. This year, his classes switched from online to in-person learning. Steven comes to all of his classes with a face mask, Lysol wipes, and hand sanitizer as he walks around campus prioritizing his physical distance. Before class, Steven washes his hands and cleans the seating area. During class, his mind wanders from the class content to the germs around him and the satisfaction it would bring him to wash his hands once more. These impulses get worse at home as he extensively cleans, showers, and washes his hands on repeat. Among his friends, he gets very uncomfortable even at the thought of sharing food, drinks, and personal items. His parents have noticed his behavior and have gotten very concerned for his mental health. Steven might be diagnosed with obsessive compulsive disorder, more commonly known as OCD. OCD consists of patterns of unwanted thoughts along with fears which can turn into obsessions. These obsessions can turn into repetitive behaviors and compulsions and interfere with daily activities. Ignoring these impulses can increase feelings of distress and anxiety. Performing compulsive acts can help to ease stress and tension, but will lead to ritualistic behaviors. Most OCD patients are hesitant to get help because they may feel embarrassed, but treatments are proven to be effective. OCD typically revolves around certain themes. In Steven's case, it's getting contaminated by germs. Symptoms for this disease are typically obsessions and compulsions, such as actions that are excessive and unreasonable and interfere with daily activity. Although experts are not sure the exact cause of OCD, genetics, brain abnormalities, and environment play a big role in OCD patients. The risk factors that contribute to someone developing OCD in their lifetime depend on family history, life events, and other mental health conditions. There is nothing wrong with having OCD. The treatment for this condition involves some therapy and medicine to help relieve some of the stress. Although the treatments are proven to be super effective, it may take months before any progress will be noticed.
Henry is a freshman who recently started university. He attends all his classes, studies at a library, maintains a physically active lifestyle, and hangs out with his friends on campus. It would appear that Henry is living a normal, healthy life of a university student. However, a few weeks pass by and would begin to notice some concerning symptoms. Overall, his friends would still describe him as an outgoing, motivated, and friendly person. But every once in a while, he would adopt an entirely different personality for a few days. During this time period, he becomes easily irritable, extremely antisocial, and presents signs of mood swings. Henry would also find it difficult to go to classes and have the motivation to attend his academic and personal responsibilities. He would often feel sad, hopeless, and lose interest in many hobbies. Though, as soon as these few days pass by, Henry goes back to being his old, cheerful self. It is likely that experts would diagnose Henry with bipolar disorder. Bipolar disorder is defined as a serious disorder of mood characterized by recurrent episodes of depression that are usually separated by periods of relatively normal mood and functioning. Studies have demonstrated an increase in bipolar disorders over the past few years, and college students in particular are one of the highest risk groups for this disorder. This is because, while college students adjust to college life, they are more likely to assume new habits that include poor eating habits, less physical activity, problem in alcohol use, and poor sleep habits and quality. Another prominent correlation is the relationship between bipolar disorder and feelings of stress, low self-esteem, and low self-efficacy. Treatment options are generally broken down into two streams: medications, which include, but are not limited to, mood stabilizers, antipsychotics, and antidepressants, and psychotherapy, which could include cognitive behavioral therapy, psychoeducation, and family-focused therapy. Hopefully these treatment options can help Henry manage his symptoms.
Meet Claire. Claire has just started attending university, and her transition to university was accompanied by many other changes in her life. Recently, she hasn't been feeling like herself. Claire doesn't have the motivation to work out anymore, but is continuously losing weight because her appetite has been affected. She is having difficulty getting out of bed every morning to go to her classes, and even when she does, she is having a hard time concentrating and remembering deadlines. She undergoes multiple bursts of tearfulness, sadness, frustration, and anxiety throughout the day. This is all new for Claire, and her friends are worried for her, so they encourage her to talk with a doctor. The doctor tells her that she might be struggling with major depressive disorder, also known as depression. It is a mood disorder that causes a persistent feeling of sadness and loss of interest. There is no single cause of depression. However, different causes such as stressful events, personality, family history, poverty, loneliness, and alcohol and drugs can combine to trigger depression. The average length of a depressive episode is around 6 to 8 months, and there are different treatment options available. Psychotherapy such as cognitive behavioral therapy is one of the options that can help individuals to recognize and correct negative automatic thoughts while trying to focus on the present. Medications such as selective serotonin reuptake inhibitor or SSRI also increases serotonin levels in the brain, which can have good effects on mood, emotion, and sleep. The doctor reassures Claire that she is not alone. A study found that the prevalence of depressive symptoms among university students around the world in 2021 was 34%.
but unfortunately, as many as 75% of students who are struggling don't seek help. Why is that? This can be because of the stigma that exists in our society around mental health. Through increasing access, awareness, understanding, and education, we can end this stigma and offer the support and resources that students like Claire need.
Although these 4 stories are fictional, real college students around the world are experiencing similar situations in their everyday lives. Research interests in mental health and well-being in university students have grown exponentially in the last few decades. Though, it is interesting to note that even with the increase in research interests, the majority of university students experiencing mental health problems and poor well-being are not receiving the treatment that they need. Perhaps this calls for increased attention in the implementation and delivery methods of mental health services to college students.
This video is meant to be used for educational purposes only and should not be used for diagnosis. We are not doctors. If you or anyone you know is experiencing any mental health related symptoms, make sure to visit your physician for diagnosis and discussing treatment options.